All right, welcome back, everyone. Hopefully you all got some refreshments and were able to stretch your legs a little bit between our two sessions this afternoon. And so it's my pleasure to introduce our permanency panel and my colleague Angelique Salazan, who you met during the welcome kickoff. But as a quick refresher, Angie leads our policy work. She is the policy director of CCAI, worked on the Hill, has done a lot of nonprofit work and advocacy work, and so she will be our lovely moderator today and introduce this rockstar panel that we pulled together. So Angie, I'll turn it to you.
Thanks, Kate. So the purpose of this panel is to hear from folks in the field who have amazing expertise and have also spent their time doing work in the child welfare system. In your folders, you have a detailed bio of everyone who's on this panel, so take a second to read that. We're gonna have a panel discussion and then a breakout session, 2 breakout sessions where you'll have the opportunity to have 2 conversations, so please take a look at the topic areas, and that is where you will be. But on the panel today, we have Anna Cotto with Post-Adoption Learning Services, or PALS. We have Cordelia Crenshaw with DC Child and Family Services. We have Dan Berger with Curran, Berger and Cult Immigration Law. Camila Bunn with National Adoption Association. Carrie Richmond with the American Academy of Pediatrics and Unbelievably Resilient. Dr. Belina Shaw, the Senior Medical Advisor with the Substance Abuse and Mental Health Services Administration. Nicole Taylor with Congregation for Kids. Rebecca Valley with Family to Family Support Network. And Dixie Weber with Peace Health Systems. Jaya Lent with Generations United, and I will be your moderator. So we're gonna get right into the panel portion so we don't waste any time with our panel of experts. But the first question that I have for all the panelists, and you can all answer as you would like, what are some of the trends that you're seeing in your areas of expertise and the barriers associated with them, and how does that prevent children from obtaining permanency? So whoever'd like to start and answer the question, please feel free. Or I can choose you. Please turn your mic on.
I can start. Hi, everyone. It's such an honor to be here with you all and amongst my fellow panelists. I would just like to point out the trends that I currently see working with transition-aged youth as they transition into adulthood. And the trend that I'm seeing is that the statistics are still the same. 50% of youth who age out of the foster care system, regardless of their permanency goal, is that they will end up incarcerated, that they will end up without a job by the age of 24 years old, that only 24% of these young adults will graduate from high school. So the trend is despite adoption, kinship, guardianship, we're not preparing these youth for their transition into adulthood, and we have to begin to focus on when do we prepare them and how we're preparing them. And some things that I've seen in my research is that they're not focusing on their well-being and their mental health. They're struggling as they transition into adulthood with their trauma that they faced in these systems. They're struggling with having the support of a trusted adult, and not just one, they need multiple. I mean, think about it. How many of us have multiple mentors, have multiple people that we can often call? And the last thing is just their overall preparedness and ability to stay connected to systems and navigate the resources even when they face barriers.
Thank you, Cordelia.
If I could build on that, I'm Anna Cottle, and I'm grateful for the question, Angie, and thank you for that, Cordelia. I work with primarily international adoptees and their families, and I'm a special education advocate, so I go to IEP meetings and Section 504 meetings, and a lot of families that I see are really unprepared in terms of being knowledgeable or well-versed or having somebody who has explained the options to them when it comes to special education or wraparound supports in the community for their family or disability support in their community specifically. And I'm thinking of things like the Katie Beckett waiver or things like ABLE accounts, but I'm also thinking about services on the ground in school on a daily basis. And a trend that I've seen that has made it a little bit more challenging actually to work as an advocate is confusion around terms like equity and intersectionality and disproportionality and social emotional learning. And I think sometimes when those words are loaded in a way that causes parents to fear them or providers to fear them or to maybe, politically charge those terms sometimes, the children are the ones who get caught in the crossfire from that, especially children in what I see described within policy world as transracial families. And when I say transracial, what I mean is, especially for internationally adoptive families, primarily most of those families are increasingly parents who are adopting children with disabilities, parents who are adopting children who are a different race or a different ethnic background than their own. And when we talk about terms like equity or disproportionality, social emotional learning, we're talking using language that has been established within the world of policy, places like, or policy like the Individual with Disabilities in Education Act or Section 504 of the Rehabilitation Act of 1973. It's long established language. And when that language becomes weaponized, what happens is we remove a functioning framework that we have to be able to talk about what our kids are experiencing, especially when they're at school and especially when they're out in the community. And where that becomes a barrier to permanency is when our children have uncertainty about how to describe the things that they're experiencing or the things that they're feeling, then they're not sure if they can talk to us as parents, or they're not sure if they can talk to their parents. They're not sure who they can go to get their needs met for felt safety. And so what I'm seeing within that as a trend is children who struggle with feeling as though they have voice and choice in their family. And I'm borrowing that language from Dr. Karen Purvis and the incredible Empowered to Connect curriculum that she created. But when we give our children voice and choice, or for providers, if you're helping parents to understand how to support their children with voice and choice, you're increasing permanency on a very deep level, and it takes, it's a daily practice, really, but that's a trend that I'm seeing.
Thank you, Anna.
I'll chime in for a moment. Oh, the other side of the table want to go? Okay. Not to dominate down here. Just want to share a little bit on the domestic side in terms of from the workforce perspective. And number one, I would love to refer to this barriers as opportunities versus barriers, because I do believe that we are where we are, but it doesn't necessarily mean that's where we have to end up, right? So as we grow and learn, and we learn about how to define certain terms and how to work better with our families, I think we can do better and do right by our children, youth, and families. So one of the ways that I think we have the opportunity to learn is to ensure that our workforce is effective. Our workforce, obviously we all start out in social work wanting to help families, but unfortunately there are moments where we harm and unknowingly. So really getting in touch with our own biases and how that is affecting the decisions that we're making, how that's affecting our own mindset and the decisions around who actually gets to parent the child, how often we search for family, and how important it is to maintain connections and relationships with all extended families. And you might be looking at my name tag seeing, well, you're a National Adoption Association. How does that fit into the mission of your work? And ultimately, our board of directors and myself, we all believe that adoption is addition, not subtraction, and it's about the expansion of all of those who love and care about the young people that are coming together and preventing divided loyalties. So I would say, one of the barriers that we see or the opportunities to learn is to really become in touch with our own biases and take a step back and think about the youth and the relationships that matter to them.
So thank you to Angelique for having me, and to Drs. Miriam Delphin-Rittman, as well as Dr. Anita Everett at the Substance Abuse and Mental Health Services Administration, or SAMHSA, who are having me here on their behalf today. And as far as trends in behavioral health, as a child psychiatrist, a child and adolescent psychiatrist, some of the areas that I have found concerning in my practice and nationwide are just the overall rising rates of mental health conditions in youth in general. So last year, the Surgeon General declared a mental health crisis for youth, and this was for all youth. And when you look at the data, all the symptoms were worsening prior to the pandemic, and the pandemic exacerbated it. So I like to think of it as an example of I have a friend, Ruby. She has dog passed away, but a cute little dog. And I always used to think of it as an example when I think about trauma and youth, that, if it rains outside, we put on a raincoat, right? And we just sort of go on our merry way. The little dog, the dog freaks out. The raindrops are really significant. So separation from families, but then also when we think about the pandemic was stressful for all of us, but when youth were just trying to develop and normalize what life is, that type of impact can be just so devastating. And we'll all be changed forever from just the pandemic in itself. Some other really disturbing trends are just the over-medication of youth in foster care, and just the extra pharmacotherapy. And it's one thing if the youth are getting extra medications, but should hopefully be getting supplementary treatment planning and other therapeutic modalities. And we're noticing also that there's data that's showing that that's not the case as well, that they're not getting the other ancillary treatments, and that can be. And actually, I should say those are the foundational treatments, and as a psychiatrist, I see that medication's really the tip of the iceberg as far as what treatments youth should get, and that's unfortunately not the case for foster care youth. And then just as, with 988 just rolling out the new Suicide and Crisis Prevention Lifeline, or the extension of the old Lifeline, I just want to talk a little bit about crisis services for youth. So foster youth are often, ending up in our emergency rooms and boarding if they have a behavioral health crisis. They end up staying for days, weeks, sometimes even up to months. And so some of the work that we're trying to do is making sure that there are systems in place so that youth can get served in their homes, as well as being able to get served in the community. So I think those, and then actually, since I'll mention, I sit in the Center for Mental Health Services, but I will say a little bit about opioids on behalf of my other sister center, that there have been some correlational trends about the increase of youth in foster care with the timing of the opioid epidemic and the worsening of the opioid crisis. And there has been some data that shows that as the opioid epidemic has gone on and we've started to expand treatment, that treatment actually has shown decreased numbers of indicated neglect for youth that were referred. So treatment works, and access to treatment is important. But when we go back to equity and workforce, we know that for all these things, that the population as a whole, especially the Black and brown communities, are not benefiting in the same ways as the majority of America as well.
Thank you, Dr. Shaw.
When you walk in a room and you're like, oh, these are my people. I feel this. I work in the foster care space, and I don't know if it's so much of a trend, and sometimes it can be kind of disheartening, but just the fact that people don't know what they don't know. And so I often say, I work with a nonprofit in North Carolina, and I often say, we're advocating for a group of people where we can't tell you about their stories, we can't show you their faces, but trust us, they exist. And most people, especially right now in the world that we live, because of things like this, I mean, I can validate everything in a quick Google search, or I can go on social media and get the top headline of the day. You're not going to get the stories of these kids that way. And so because of the immediacy of information that we've seen over the past few years, I honestly think that's hurt the advocacy that we are perpetuating in terms of advocating for these kids that don't have that stability, love, safety that all kids should have. It's non-negotiable. So one of the things that we talk about is getting creative when we're telling this story. We oftentimes work with churches, and so when we go into a new church, I'm like, don't say anything about foster care. Don't even use the name, because if you do, no one's going to come. What we need to talk about is what this is, and it is the most vulnerable children in our city, in our country, and that's the way that we need to be talking about this, to be able to get people's attention before they discount you, before you even get them to the table. And so I just think this idea of reimagining how we're talking about this, being able to validate it quickly in creative ways, which we're constantly thinking about how to do that, at the same time making sure that dignity factor is still intact and we're not exploiting children and their stories. And so it's tricky, but I think that collectively we can do that in ways that I'm excited later to share, where we've gotten creative in our own cities to be able to do that effectively.
I would love to build off that, because I think I'm very aligned with that. From my perspective, as someone who was in foster care and experienced a failed adoption and works with other individuals who were in the foster care system to change the narrative of how people talk about us, how they talk about this issue, I really do think that is such a barrier and a trend that's persisted for way too long, where you have constantly stories of trauma, stigmas, stereotypes being pushed forward, where it really makes people want to look the other way. They don't want to take the time to learn about foster care because they have preconceived notions about what it is to be someone who is in the foster care system or to be a foster parent. And a lot of that is fear-based, and it's rooted in stories of trauma. And I think that in order to see some significant shifts in helping young people to get to a place where they want permanency, right? Because there are really a lot of, and I think Cordelia could speak to this, a lot of young people who are older, they say, I don't want to be adopted, because they're in a position where they're choosing from their birth family or this new family. And there's a piece of loyalty that makes it really challenging to be in that position. And so they also don't want to feel like, oh, here's this person who thinks that they have to be my savior when I already have a family. And there's a part of me that really wants to be with that family. And let's acknowledge that and have open, honest conversations about that piece of permanency. And then finally, I think like the biggest piece of it is flipping the script and telling stories of triumph and redefining what it means to have permanency. Permanency does not need to be adoption. It can be a permanent, lifelong connection, someone who steps up and into your life and says, I don't need to fill out these adoption papers. I don't need you to have my last name, but I'm always going to be in your corner. I'm always going to be rooting for you, and whatever matter that looks like and whatever you need. So let's expand our definition of permanency, and let's really start to get at some of these stigmas and stereotypes that are misinforming the public on what the foster care and adoption crisis is.
Thank you, Carrie.
Thank you, Carrie. That's hard to follow. I want to just build on that a bit, because when we talk about changing the narrative, one of the trends that we've seen in recent years is a shift in how we think about kinship care. So when I started this work 20 years ago, there was some language around the apple doesn't fall far from the tree. If you can't raise your own kids, why can you do it for these kids? And what we've seen, and the research shows clearly, is that children do well in kinship care. In fact, the outcomes for children in kinship care are much better in many areas than those in care with non-relatives and foster care. And so there's recognition of this. I think the child welfare system is seeing this both for what the research says and what the reality shows, but also because there's a need for homes for kids. And so both of those things coming together, we're seeing increased numbers of kids in foster care with kin versus non-relatives. We're also seeing child welfare systems that do what they can to keep children out of foster care and place them with relatives to prevent them from coming into care. We see kids with kin as a good thing, so that is a positive trend. What we haven't seen catch up yet is providing the support to those kin when they step in to take care of children. It's like, oh, you're here, you love them. Because you're related to them, for some reason, that means you have enough resources and support to care for them simply because you're related. I don't know what the math is that leads people to that conclusion, but that's what we're seeing. So we need to be catching up and providing those supports and services to kin. There are some places where we are seeing some supports and services available to kin, but they're the same kind of supports and services that are the same training that is available to non-relatives, and these families are different. They're complex. Carrie talked about dual loyalties to birth parents and perhaps adoptive parents. With kin, you have multiple loyalties too, right? So the grandma wants to make sure that she is giving first priority to this grandchild, but she also has her adult daughter or son who may be struggling to overcome an addiction, struggling with substance use or mental health, and there's loyalty there, where you have a child welfare system saying, well, you can't have this parent in the household, or the parent, you can only visit, between the parent and the child in the child welfare office. That doesn't feel natural. It's not a way to support relatives. So when we look at trends, we see kin as a solution. We need to provide them as a support. We need to provide them the supports that are tailored to their unique circumstances. Thank you.
Well, this is great. So I'm an immigration lawyer, and I come at this from the international perspective, and it's so interesting just to hear everybody's perspective, because I wanted to make a little footnote on everybody's comment. But obviously, we deal with two situations. One are kids who are here, who have complicated immigration situation, and sometimes, and I think going to your point about adoption isn't always the answer. Sometimes people come to us and they say, well, can I adopt this child to help them have more permanence? Because I don't have to tell you this, it's just incredibly disheartening for young children to not have immigration status, because then they feel as if, well, what's the point? What's the point of going to school if I can't work at a job that's going to ask me if I have papers? I can't get financial aid, I can't get services. I want, some of the cases that we apply for involve going through some of the most difficult things that have happened to kids, the humanitarian categories. And to do that, I'm not a social worker, I'm a lawyer. To do that without access to services is really hard. So I think for kids in the US, the message that I'd love to get out is, please try to help them connect with immigration services as best you can. The Immigrant Advocates Network has a directory by zip code, but the earlier, just like a social worker, a doctor, or anybody else, the earlier we can get to a kid, the better. There are things, immigration's a game of categories, and there are things that we can do when kids are under 16 that we can't do, and then a few more things that we can do when they're under 18, a few more things they can do when they're under 21. But the best time for immigration for kids is when they're young. There's just more categories and more flexible categories. And so we're trying to get the word out, and it's hard to do that. We're trying to connect with schools. Sometimes we'll talk to people at an elementary school, and there's one or two kids who have opened up to a teacher that they're undocumented. We want to try to figure that out and help. And sometimes adoption is the answer. Sometimes there are other immigration categories that help them have some permanency within the families they're with. For kids who are outside the US, just really quickly, the biggest challenge that we're seeing is really capacity. The immigration system, the US Immigration Service, the State Department have really been degraded over the last few years to the point where a U.S. family who knows a child abroad, this can take years for us to bring the child over. And the processing times are going up, meaning delays in a family being able to move back if they're abroad, or the child being able to be with the family and to start to receive services. So what we're looking toward in advocacy with government agencies is increasing the number of adoption agencies, because every international adoption has to be brokered by an agency, and there aren't enough, and then increasing capacity at the State Department and the Immigration Service. And about kinship, over 40 million Americans, over 40 million people in this country were not born here. So what I'm seeing over the 25 years I've been doing this is I'm getting more and more calls from people who say, you know, my niece or nephew or my younger sister or somebody, a child in my life abroad is in crisis or at risk. A parent has gone to jail or gotten sick or whatever. And the closest relative is here. Our immigration system was not set up this way. The State Department is considering regulations that would create a path for relative adoptions, but those are really, really tough cases. And it's very frustrating because sometimes you just want to bring a child in crisis over to their aunt or uncle as soon as possible.
Well, my focus is domestic infant adoption, so you're probably like, what is she doing up there? But stay with me. I do think what is happening in domestic infant adoption is going to ultimately impact foster care. I think what we are seeing in hospitals and the concern for internet matching and women that are in crisis that are, as my 92-year-old dad says, going to the Google and finding parents for their baby. The expenses that are exchanging hands are immense. We know we have a lot of unlicensed brokers that are setting up matches that are heading into hospitals, and it's our nurses that are at the front line when everything blows up. When she walks in the door and all she has is a folder from someone she met online, and the family's on their way from out of state to come pick up their baby. And when that happens, it's not uncommon that we see she's had no counseling. She does not know what's available to her for parenting. She does not know whether there is kinship that's willing to step alongside her. She's been in a panic mode. She's dealing with an unplanned pregnancy and has to have a plan. And the internet is super convenient to make one. Now, when she changes her mind in that hospital and she says, I can't do this, we don't have a lot of options. The nurses are at a loss. We have a case manager that may or may not be on during that 2 a.m. Saturday explosion that happened in the birthplace. You guys all know that's when this stuff happens. We also know with the shortage in staff that we have case managers that are coming through from other units in the hospital that are being asked to navigate these situations where a mom is choosing to parent, has no parenting resources, doesn't have a plan, but has to be discharged. We have to discharge her. So what do? We contact Child Protective Services and we start a file at social services and we hand her off. So you can imagine with the Dobbs decision, and knowing that we are involved in the hospital, that we are caring for women upstream that are trying to decide what they're gonna do. After we created our program at the hospital, we actually met women very early in pregnancy. They were not gonna terminate, but they didn't know if they were gonna parent or if they were gonna place. And the hospital created a space for them to explore their options with people that had no skin in the game. I often said, I don't care what you pick, I just want you to be successful. And so knowing that we don't have infrastructure right now in the prenatal space, we do not have standardized resources and referral systems in the prenatal space, we are gonna see many, many more crisis situations in labor delivery units all over the country, and it's not gonna be pretty. So it's a huge gap, and it is gonna continue to impact foster care because we're going to end up putting these children at risk without good resources. Why are we not having these conversations when they're pregnant? Why are we taking children from homes and then having the conversation? Makes no sense. And on the other side, why are we waiting to give trauma-informed information to parents that are taking kids home? Stepping in, again, crisis intervention. So I've been back to the Hill many, many times fighting for hospital training around adoption-sensitive care, as I mentioned earlier, but the bills that are in place that we're fighting for right now to fill that gap, Kelsey Vanderfleet-Rainier's here with me. I want you to raise your hand. She's working on a bill right now for unlicensed brokers that are literally baby to the highest bidder right now online. We could do a whole Lifetime movie. There might be one in the makings that we're working on with what is happening, trying to really emphasize the gap and the danger to families right now. We are also working on a bill that will address the gap in hospital training. We know when we go in and train nurses, our stats show 98% of nurses have no adoption sensitivity training. So they come in and their implicit bias comes in. If she's dealing with substance use disorder, all of a sudden she's the crack mom at the end of the hall that's given up her baby. That's not the conversation that has to be happening. We have to talk about how we're talking about our patients and how we're empowering them to make decisions, not stepping in crisis management and impacting the foster care system. And I have no doubt that this is going to continue to escalate, and we have to address it as early as possible, and that's in the prenatal space and at labor and delivery.
Thank you, Rebecca.
Rebecca did such a nice job. I'm Dixie Weber. I actually represent the healthcare side of this. I'm a nurse. I've been a nurse for 20 years, and I oversee women's and children's healthcare services in the Northwest for Washington, Oregon, and Alaska. And I was an angel in 2017 for the work that I've done with Rebecca, and we have trained hospitals and healthcare providers all over the country. And she's not joking, we have no idea what we're doing. And we would really like to know what we're doing, but we don't. We know today that it is not part of our core curriculum in the medical schools or in the nursing schools that we have any foundational education on how to support women who are making an adoption plan, families who are meeting or growing or learning about their families through the adoption process. Most of the models of care that we are trained on is the mom-dad-baby triad, and that is just not what our families look like today. And so we are coming to the table with our own biases, and they are really getting in the way. And the trends are that we are getting in your way. And the hard part today is that we receive calls, and we are not joking, every day across the country around, I think we have an issue, and we might not be doing this right, and have you come across this before? And they're really scary stories of clinicians walking in and sitting at the bedside of a woman who has made a clear adoption plan and has the plan in place, and the nurse sitting at the bedside and saying, you can't do this, and crying at her and bringing diapers into the bedside, which is not appropriate. We have housekeepers badging in on their day off and bringing diapers into the bedside of a woman that has made a clear adoption plan, saying, you can't do this. We have physicians saying, I will not discharge you if you are making an adoption plan. Today, we have all sorts of issues with our healthcare providers, and we as healthcare providers, some of us know this, because some of us are opening our eyes and seeking education and working along some of us that have this education and saying, please train us, and coming to the table and asking for it. And Rebecca and I, just even the last 6 months, have trained thousands of nurses and doctors in just the last 6 months alone in this. And the Dobbs decision, they're coming to the table and saying, gosh, we think that we're going to have more patients that might need our help. However, there are a lot of healthcare providers that are completely unaware that they don't know what they don't know. And so when we walk into a classroom, oftentimes, because they're there for mandatory education, because someone, an executive at my level, has said, hey, guess what, I don't think we're doing this very well, you should come to mandatory education. They get there and they're like, I don't know why I'm here. 5 minutes in, they're like, I cannot believe I did not know this information. I can't believe that I've worked my whole career and no one has taught me about accurate adoption language, what it actually looks like today compared to the model in my head from 20 years ago. And also the other piece of the puzzle is I work within pediatric healthcare. My job is to oversee programming for all of pediatric services for 6 hospitals throughout 3 states. So as my friends talk about substance use disorder and the mental health crisis that our pediatric patients are facing today, part of my job is for healthcare is to make sure that when you have that patient come in through the emergency department, and it may be your child that you're caring for, that we don't get in the way and make it worse because we're not trauma aware. So we have to be trauma informed and trauma understood to be able to partner with you and not escalate that situation and make it worse. Because today we're not set up well to be able to support you through that infrastructure. I have 6 emergency departments, and at any given time, I am housing pediatric patients in those emergency departments because I have no place to place them who are in psychiatric crisis situations. And an emergency department is not the best place for them. However, I don't know how to partner our parents. And I think this is where I feel like the trend, and really COVID has highlighted it and has made it worse. And so I'm so happy to be on this panel with you today, and I'm so happy to be here as a partner today, because this is really, I think, healthcare's chance to raise their hand and say, we need you as much as you may need us. Like, you may need us for our medical skills, but we need you as parents and partners to help teach us how to do a better job at what we're doing. So in that trending, we want to be better when we're at the bedside in labor and delivery. We want to be better. We're in that, opportunity to be able to be a better partner around parenting and conversations about how are you feeling about this pregnancy. But we also want to be better when your child's in crisis. And you need a healthcare partner in those midst and in those moments. So please come and talk to me, and please tell me your story so I can take those stories back to our clinicians and help them be better. Thanks for having me today.
Thank you, everyone, for answering that question. Now we'll have a specific question for you all, and I'll start with Dan. What are some of the biggest legal obstacles policymakers should be thinking about when it comes to the field related to inter-country adoption? Please limit your remarks to about 1.5 minutes.
All right, thank you. Two I've already sort of hinted at. One is there needs to be a path, I believe, for relative adoptions. The State Department had issued draft regulations toward the end of the Trump administration. As you may know, all regulations that were issued toward the end of the Trump administration are in review. It was really good. The American Academy of Adoption Attorneys thought they were great. We submitted strong comments. We'd love to see that issued as soon as possible. They're a path for kids to be with family members here if there's a parent in crisis abroad. A second one would be, again, to try to increase the number of international adoption agencies. You can't do an international adoption in a lot of cases the way the Hague Convention is written without a Hague-accredited adoption agency here. There just aren't enough. We've worked with the Small Business Administration. We'll work with anybody who's interested to try to build capacity. It's happening slowly, but not fast enough. And the last thing I think sort of hits on what I talked about before, which is speed. There needs to be a path for children in real crisis. There isn't right now. We have not been successful in using a very serious mental health crisis as a way to move along an immigration situation. We've made some proposals right now. Sometimes kids get through with a wink and a nod from an immigration officer without a lot of procedure, and there should be procedure and there should be a path for expedite.
Thank you, Dan. This question is for Cordelia. When it comes to permanency for older youth in the foster care system, based on your work with young people, how have you seen a young person benefiting from being as involved as possible in their own development?
So from my perspective in the work that I do, it is so critical for our young adults and our youth that we serve and we work for to have a seat at the table. Not only to have a seat at the table, but for us to listen. I am very guilty of having all the answers and trying to change because I consider myself a change agent. But I think the mark that we're missing is actually sitting and listening to these youth. I want to share a story about a young man that I currently work for. He is dual jacketed, and when he is invited to these team meetings, there are 10 plus people in the room. And he probably couldn't even go around the room and tell me their names and what they do and how they serve and work with him. That's a problem. How is this youth navigating these meetings? How is he able to express himself and what he needs, his desires, his goals? It got to a point where he would engage with certain people of the team and not with others because it was just so overwhelming. So we have to educate them. We have to educate them on not just their experiences, but the process. How do you navigate these team meetings? How do you ensure that the people that support you are there at these team meetings? We sit at the library and just people watch because it has become so overwhelming for him to the point where asking him a question, he just doesn't know the answer. He spent several years in the juvenile justice system. So he's stagnant, right? He comes home, he has all of these people trying to encourage him, right? We're trying to encourage him to get his GED, to go to school, to get a job, but he just wants to be safe. He just wants to be heard. He just needs some patience and some understanding. Yet us as professionals, as workers, are pressing the adoption goal, pressing the permanency goal, pressing for him to have life figured out, and he's only 18 years old. And he spent 3 years of his teenage years in juvenile justice. He's not ready. And then there are people around the table that are not listening to him. So the first thing is to listen. Listen to these young adults and give them the opportunity to have a seat at the table so that they can express themselves, so that they can have the opportunity to share their goals, dreams, and desires. But then also, how do we do that? We have to make sure that they have someone that supports them, that cares for them, that they have a bond and relationship with, guiding them and navigating them through this process as well. Oftentimes, when these youth are reliving their traumatic experiences, they get frustrated, they get upset, they don't know how to lead the meeting. So preparing them in a way that they're knowledgeable and that they know how to navigate that meeting is critical, but it's so important for us to listen to them and not be quick to give them answers to what it is that they're trying to figure out.
Thank you, Cordelia. This question is for Nicole. What are some of the challenges you're seeing in the child welfare space in terms of getting more people involved and more specifically becoming a foster or adoptive parent?
I think that we are tasked to normalize something that really shouldn't be normal, but it is. And so oftentimes when we walk alongside prospective foster parents, it's, let me introduce you to someone that's already doing it. And 9 times out of 10, they'll say, gosh, that family looks like my family. Or those kids are just like my kids. Like, they're just normal, regular kids. Granted, kids that have been through trauma, for sure. But I'll just speak bluntly, there are so many myths that we have to debunk. One of them being, kids don't need another backpack full of things. They need you. They need a person. That relational support is the most impactful thing you can do for a vulnerable child or family, for that matter. And so looking at sort of varying degrees of entry, right? Like, becoming a foster parent's jumping in the deep end of the pool. There are so many other things that you can do. We often say, for those of you that know Jason Johnson, we say all the time, everyone can do something. Whether it's maybe if you are a person of faith, joining a prayer team specifically for children in foster care. Maybe it is uplifting child welfare professionals because the high rate of turnover negatively affects children in their permanency. Maybe it's becoming a mentor. We have a program that really is around that voice and choice model. Everyone can do something. Maybe it is bringing a meal to a foster family. Whatever it is, everyone can do something. And so really being able to tell that story and being clear, which I feel like I can speak, bluntly in this room, but being very clear with people about something that's very complicated and nuanced, and doing that with grace, right? I don't usually say to groups I speak to, let me tell you, don't do the backpack. You need to step up. Usually don't say that in a typical crowd, but I think you all know what I mean.
Thank you, Nicole. This question is for Carrie. Based on your work, can you speak to the importance of healing from trauma so that cycles of pain do not continue?
Yes, and before I answer the question, I want to ask people to just shout out, how old were you when you started your family? Go. I only have a minute and a half. 23?
28.
38? Louder.
28.
28? 19? Okay. I ask you that because I think there's so much importance in helping our young people to heal and process the things that they have that have happened to them. And I think one of the biggest failures of the child welfare system is we sit at tables creating legislation, creating programs, and we talk about the importance of moving upstream and the importance of preventative programs. But we're missing the mark and preventing it at the very point in which it starts, which is where someone's going to create a family. And most young people are creating families, especially our young people in the foster care system, between the age of 16 and 28. And so that is the point of intervention, where we need to be most proximate to them and most in conversation about what is it that is inside of you that we need to process and heal. And in order to do that, it can't come from this inorganic place where you're making a young person feel like something's wrong with them. It starts with them having safe people and safe places. And I don't just mean that a physical space, but I mean that emotionally safe people who they feel comfortable starting to sort some of these things out and to really process their pain. And then it's about moving that pain and moving that trauma through. So we are so dependent on talk therapy, and we're shoving psychotropic medications at young people, and those aren't always the most responsive modalities when we're looking at people who have been in cycles of trauma from the time that they were toddlers in some cases. And their nervous systems are stuck in fight or flight or freeze, and they can't process new information. And so here we are sitting at our tables, and we're like, oh, we definitely need to help more kids get to college, and that's gonna be the answer of breaking the cycle, and that's moving upstream. No, it's not. They can't process new information. Why do you think our graduation rate is so low for young people who are in the foster care system? Less than 3%? That's because there's a larger root cause. And that cause is helping them to understand that they are worthy, that they are enough, that they are not going to repeat the cycle, that people care enough to see them and to help them and sit with them in their pain. That's what I think is moving upstream, and that's what it means to be preventative, so that we stop feeding the beast that is the child welfare system, that is the foster care system.
Thank you, Carrie. This question is for Camila. How does advancing equity improve outcomes for all children and teens awaiting permanency, and why is that particularly important for the professionals in the field?
I want to first begin by defining terms. So when we talk about equality, we're talking about equal treatment for all. And when we talk about equity, we're talking about giving people what they need to succeed, right? So I think it truly applies to the child welfare workforce in that it's not a one-size-fits-all approach, right? But yet we are kind of stymied in many ways around, standards and complying with, what the procedures are, that we kind of lose sight in a way of what really the work is. And the work, to use Cordelia's term, is, listening and learning from our young people and the relationships that matter to them. And when we do that, we're talking about recruiting from communities from which the children came, so that they have relationships with people who are emotionally safe, where they can feel comfortable being their authentic self, where they can truly feel that love, that safety, that feeling understood culturally, right? And then also feeling supported unconditionally. So in that, we're talking about social workers in the workforce being comfortable going to those communities, right? And really having those conversations with the people that matter to the young people. If we're really listening to them, then we're gonna be out there searching for them, right? And with them. So that's really what it comes down to, is a systemic change that's needed in order for the child welfare workforce to catch up with all of our great ideas that we have and our policies that we have. But what are we doing really in practice that is modeling those actions that we want to see and those policy changes that are coming down the pike? And with that, I believe we can ultimately improve outcomes for all. If we're being cognizant of the youth who are most disproportionately reflective of the child welfare population, then all will benefit from that work. All will benefit by their voices being heard. All will benefit by knowing that the workforce is looking for those relatives and fictive kin that matter to the young people.
Thank you. This question is for Rebecca. What is needed from healthcare to support your work, and what can the healthcare space do better to be a better partner?
How much time do we have, Bob? No. Yeah, 1 minute. I think what Dixie had mentioned before, the education, just to know that they don't know, and to realize the chaos at the bedside that can be addressed with education prior to it ever happening. that buy-in is huge. I think that. Hospice. Oh, yes. Thank you, Dixie. Yeah, just knowing, especially with the grief piece, and right now we're working with a hospice group out of Baton Rouge, and really being able to look at families and understanding the grief that underlies so many of the behaviors that we see in healthcare. We know that there was a study done in Idaho that found, especially after adoption placements, even in domestic, chose the family, left the hospital without her child. Without receiving support, 86% of those moms were pregnant again the first year. So if you think about not having post-placement support for women that are choosing adoption, it's devastating because, again, their situations may not have changed. What changed is that they left the hospital as a mother but was childless. They made that decision. And so knowing that healthcare can acknowledge loss in bereavement programs, it can acknowledge loss with hospice programs, and it needs to acknowledge the loss in the crafting of goodbye in hospitals for infant loss and infant adoption.
Thank you, Rebecca. This is for Dr. Shaw. What is the Substance Abuse and Mental Health Services Administration doing to address the needs of children and families who might be impacted by the child welfare system?
Sure. So the SAMHSA is primarily a grant-making and technical assistance agency. So we provide several grants, and actually, as I hear back through just the content of the panel, starting at the very beginning, there's a grant specific to healthy transitions and our systems of care grant. I'm actually relatively new to SAMHSA and had a systems of care grant in my local community where we actually focused on young people in transition. And to your point about how it's not all about therapy, as we look back, as we developed our grant, we realized that peers, family and youth peers, were basically all we funded. You know, and so we realized just the importance of inclusion of peers, and there's a new recovery office actually at the agency that's going to be focused on making sure that we're including people with lived experience in all levels of the agency. So also the National Child Traumatic Stress Network, nctsn.org. It's a very great whole network, not only of the website and the information with the toolkit. There's specific information around foster youth in their parenting resources, just a lot of information and toolkits. But then also there are grants throughout the country focused on the trauma and young people. We just had a huge conference, a couple hundred people in Baltimore this year, just last month, focused on childhood trauma. There are state opioid response grants as well, so lots of money going out to helping with the opioid crisis nationwide. But you know, I just think that in general, with grant making and TA, focusing on communities and making sure that communities, not only the ones that have the grant writers and can afford somebody to help them get the grant and manage the grant, but that everyone should be able to access grants. The Office of Behavioral Health Equity, it has a new initiative called Elevating CBOs, or Community-Based Organizations, Elevate CBOs, so that if you have an organization and you're interested in that, you can go to the National Network to Eliminate Disparities, NED, and get involved in that network, because we do realize that we want to make sure that the grants are going out to the community as a whole and not just organizations that have historically gotten them.
Thank you, Dr. Shaw. This question is for Anna. Based on your personal and professional experience, what is something that you wish families and providers understood about K-12 education that is different for foster youth and adoptees?
I think that from my experience, both personally as an adoptive mother of 2 young men who we adopted from China, and both have complex disabilities. They're both still in school. And from working as a special education advocate with adoptive and foster families, what I see is that our children somehow don't have an off switch for their needs when they go into school and spend a third of their life in school. So when they're in K-12 education, they need to have safe environments and felt safety. And some of that comes down to relationships with teachers. Some of that comes down to having providers and having families that understand that our children have unique combinations of needs. And some of that comes from being coming from hard places, what Karen Purvis called hard places, backgrounds of trauma, abuse, and neglect. Sometimes that comes from having English as a second language, and schools that misunderstand that English as a second language may be combined with an adoptee with those trauma issues. So waiting for a longer period to evaluate that child to see if they need special education or related services isn't appropriate. So they need those supports in place when they're at school. And I'll reiterate what I've heard already on the panel because I had it in my notes. There's not a one-size-fits-all approach because for each child, there's going to be something different, a combination of different approaches that meets their needs. And parents, I wish more parents knew how to access wraparound supports in their community to help them better understand how they can uplift their children and center their children's voices. And if I could, at the risk of going over in a minute and a half, y'all have been an amazing group. And I want to affirm you for a moment in that you are here because you've been recognized for your leadership within the adoption and foster youth community. You've heard a lot of information today. And so some of those issues are going to resonate with you. And some of those issues are things maybe you were already passionate about. But you also have your own stories that you're bringing to the table about your family. And I want you to think about that as you go into these meetings tomorrow, because your Hill Day meetings, your story is the most powerful thing you've got. And don't be afraid to center your child and ask them how they feel about it. Ask them what they think about whatever issue is the issue that you're talking about or the policy that you're talking about. And sometimes that's a risky thing because you might go, well, I have no idea what they're going to say. I'm not going to trust them to be the one to speak to my senator because Lord knows they'll go off like a rocket. My 21-year-old has a severe language impairment, and it's very difficult for him to put his thoughts into words. And I'll never forget when I was advocating with our Tennessee legislature regarding a bill to end paddling of students with disabilities in public school. My son, I paused in between meetings with legislators, and I asked my son, I said, what do you think about this? And he said, well, can I say something in our next meeting? And I thought, oh, Lord, he wants to talk, and it's going to take a long time. And I had to honor him because he has experience. And there's words I can put to stuff, but he's the one living it. So when we went into our next meeting, I said, Fu, what do you have to say, buddy? And he said to our legislator, you know, schools don't know the backgrounds schools don't know our history. A school doesn't know my history. They don't know if I saw a child who was hurt by grown-ups in the foster home, and they don't know if I got hurt. So they don't know what they might trigger if they decide to hit me. And sometimes I might not know what gets triggered if they decide to hit me. And that's why paddling doesn't need to happen at school. It's the most powerful thing that could have happened. And it took them a lot longer to put that into words. But you could have knocked our legislator over with a feather after he said that. And then that bill passed. And I think it was a result of my son taking that risk and talking about his feelings. And we had to do a lot of unpacking after that because it really, you know, he had a lot to process afterwards. And so I apologize I ran long, but
Okay.
Harry.
Last question is for Jaya. Can you speak to the role of kin and tell us why finding homes with relatives for children when possible contributes to permanency outcomes for children?
Yeah, thank you. So research shows that children in kinship families have more stability and permanency, so we know that. But we also need to recognize, I think, building on Carrie's earlier point, that permanency can look different ways, and we need to support that. So for many kin, adoption may not be the right choice for the family. The young child may not want to have to prove their own parent unfit in court. It does strange things to family dynamics that might make their mom then technically their sister in the eyes of the law. It's just not always a good fit, but there's other types of permanency. There may be permanent guardianship. There may even be a child that is adopted by a non-relative, but there are creative ways to engage their extended family in their lives, right? Because one of the losses often when adopted by a non-relative is loss of connection to culture sometimes and community. But if you have grandma that routinely is connected, could not be the placement for that child, but routinely can have a phone call with her granddaughter or her grandson to say, you know what? You have really cool big hips. Your aunt had really cool big hips. You know, they're beautiful. And this is what her life was like. You know, just really making those connections is a critical type of permanency that looks different than what people typically envision. Thanks.
Well, I want to thank everyone for their time in answering these questions. We have one last closeout question, and we won't be able to have everyone answer, but there are a range of experiences when it comes to these issues. What are some tips that you have for our angels today in using their voice as they prepare to meet with their members and offices tomorrow? We're at time, but we'll have like 2 people share.
So I know I've talked a lot about post-traumatic stress, but I don't know as many people know about post-traumatic growth, and just the concept that one's history can shape one to have such a more beautiful, more resilient future. So, you know, as people go in and talk about troubles, I think that also talking about triumphs and how a negative or adverse experience can also shape and frame someone into being you know, stronger and just not necessarily always focusing on the challenges, but post-traumatic growth.
Anyone else?
Yeah, I would say I love the Brene Brown quote that it's data and stories that create change. So don't go into these offices and spew facts and figures. Ground it in story, and not stories of trauma, but stories, try and think of stories of triumph and stories of families, because at the root of all of this, we get so jargony and we're like, the child welfare system and foster care and kinship care. At the root of it is family, connection, belonging, and that's something any of these members or their staff can relate to. And so making it relevant to them is going to get them to listen to you and what you're asking for, and ask for something. We're not here to just share stories. We're here to not create pity, but to create change, right? So make sure that you have your story and your ask, and then make sure that you're following up. 90% of people who are coming on the Hill, they leave and these offices never hear from them again. And so make it matter. Get their card and make an effort to send them an email and say, hey, I really enjoyed learning about your nephew in Idaho, and by the way, look forward to seeing you pass this bill. You know? So you guys are gonna do great, and I am fully confident in you.
Well, thank you to our panelists, and we are going to go into a 15-minute break and then go into the breakout session. So please feel free to go to a table, and you will meet your panelists there.